Testing sound, testing sound. Testing sound, testing sound. Okay, perfect. Sound. All right. Testing sound, testing sound. Sound. Hi, Mr. Powers.
Hi, Christina. How are you?
Good.
Thank you for all you're doing to make sure that our shots, we will get our shots. We really appreciate that.
Not a problem. And just so everyone knows, we are live. I've already
Hi,
set it up.
Christina. How are you? Okay. Christina, do we go in at any time on Saturday morning?
We are live. I've already set it up.
How are you? Okay. Thank Christina, do we go in at any time on Saturday morning?
Hold on one sec. Can you hear me?
I can hear you.
Okay, now I can hear. All right. I'm actually gonna type. I know what.
We go in at any time.
It's like I'm getting this feedback. Hold on. I want to make sure we don't put anything on live.
I can hear you.
Okay, now all right. See, I'm getting all this feedback. I'm actually gonna type. I know what.
We go in at any time.
Feedback. Hold on. I want to make sure we don't put anything on live.
I can hear you.
Okay, now all right. I'm actually gonna.
Can you hear me by any chance? Can you hear me?
This is live. This is our live. There we go. Now can you hear me?
Yes.
Okay.
And there's not a lot of clutter either.
I know. Sorry about that. I'm still trying to get trained on how to go live and everything. I'm sure Dr. Martel will provide a little more details, but you got a few minutes. But I have alerted Rebecca that the board members that got their shot at the last month's meeting will be pulled through this Saturday. And they started at 8:30.
Right, and we can come anytime during the morning.
Yes, but I want to confirm with Rebecca, if there's a specific time that might be better just to get you guys, in and out smoothly.
Okay, that would be great.
Okay, I'll follow up with you guys before the end of the week.
Okay, thank you, Christina.
Absolutely.
Hello, James.
Hello, how are you?
Cold.
Yeah.
I'm tired of winter.
I concur.
Right. I'm tired of snow. I'm tired of single digits. The whole bit.
Come on, Jim. Just put on 3 layers of coals and you'll be just fine.
I've tried that. It doesn't work.
It doesn't.
No, I think I might need 4 layers.
I don't like it when I'm in my own house, and even though my temperature is pretty good, my face is so cold.
I know.
And so I walk around with my sweatshirt pulled up to my eyes, so my nose won't stay cold. Isn't that terrible?
I feel the same way. I'll go along and all of a sudden I get a feeling in my nose and I go to touch it and it's like, oh my gosh, it is so cold.
I think you and I have a problem with poor circulation because of our previous past.
I think so too, Angie.
Yeah, I
I
think
think-
that's what causes it.
Yes.
But I don't like a real hot house either. I don't like where I can't breathe. I like to breathe.
Oh, exactly.
And I
Yeah.
haven't been out in this cold either. I've been home.
Good. Glad you're staying in.
Yeah, I have grandkids that do my running and stuff for me, so. And they like that because they take my car, and that way I know my car is getting run every day.
Yes.
So it works out.
Oh,
How's your wife doing?
she is doing well. She is doing well.
Good.
I was so glad when we got our shots that I got a chance to see you and you got a chance to meet her.
Nice lady. You can tell just by saying hi to her.
Well,
Some people, first meet them, you know they're nice people. There's just something about them.
well, I will pass that along to her.
And maybe I'll see you Saturday because I'm going Saturday morning for my second one.
Yes.
So I'll be coming up there. I don't know. If they get me up early enough, I'll be up there at 8:30. We'll have to wait and see.
All
Right. I guess,
Dr. Halverson's not on yet.
I think Christina will let us know about times on Saturday morning. Hello, Sandra.
She's busy talking to Christina.
It's okay.
Now
Ah,
there's
she has a voice.
I know I've got to click on some things, you know.
I know. There's a lot of clicks.
And I know clicks and wish there were some tricks to make it easier.
I keep thinking I'm going to find some, and I never do.
And because sometimes I'll be keying, all of a sudden it'll be turned off here, and I'm like, oh, well, where's the mouse? Which one was it supposed to be on? Oh, well.
it was good
Well, I
to see
have a
pictures.
chance.
It's good to hear you, Angie. I heard you on the caucuses last night. Or no, Monday night.
Monday night. Yeah, I saw you there for a minute, and then you were kind of gone. But
Well, I was off. I didn't, when they were presenting, I just turned my screen off because I was listening, but not,
yeah. I had a bunch of questions for the attorney, our new state's attorney, but I had told the chairman that, so he had the state's attorney call me during the day so I could get some of my questions over with. Otherwise, we would have had to go into closed session for some of the questions I had.
Well, Dr. Williams and I have a call with him tomorrow.
Do you?
Mm-hmm.
Hello there.
Is Charlotte,
Quorum, so you have 3.
is Charlotte going to be, is she already left for Seattle?
Friday was her last day. And
Right, it was
that's
her
some,
last day.
yes, that's some of the questions I had of our new state's attorney, because we're used to having state's attorneys being represented, our attorneys being represented on each of our committees, and wanting to know if he had appointed anyone to our committee, River Bluff, and some others. And he said he's going to have to look into it because he hasn't gotten that far, which I understand. But still, that's important that we are all assigned, each group is assigned an attorney, so we don't get in trouble.
And I also, I did remind the chairman on another meeting, because I have a weekly check-in with him as well, that we do a portion of, we do fund, we transfer funds to that department for the representation of our state's attorney.
Oh, do you? I didn't know that.
Yeah, participation, and again, to offset, again, that, it's not even just board meetings. Think about, all the agreements that are required to be looked at. I think about the variances that, like today, we had a policy committee, we'll have a resolution going forward. I don't know if he's gotten quite a handle on all the work and role that the state's attorneys in the civil division were responsible for. Which,
No, I don't think he did.
Pardon? Well, I think we never know everything that people do until they leave, right? And then we're like, who was doing that?
You know, Charlotte should have been gone, I think, a couple weeks ago. And yet she's been staying on to try and get things caught up.
Hi, guys.
Hey there, look who's there.
Hello
Well,
there.
If I'm going to be at an interior meeting, I better take my mask off. Okay, there we go.
How do you feel? Feel good?
Oh, yeah, I'm fine. And of course, I'm going to join the rest of you Saturday morning.
Good.
Good.
Can we just
Yes.
drop in anytime?
Well, Rebecca, we should be sending you your follow-up appointments like we have for the rest of the group for Saturday. So I will follow up with her.
It doesn't put time. It just says come between 8:30 and noon.
Okay, perfect then. We're working through something on our Qualtrics on that. So come between 8:30 and noon. The first half hour is always crazy. So try not to come first half hour. She's allocated the vaccine. So we have your doses ready. That's always what we remind people. I don't care what clinic we run. The first half hour, everyone's like, it's like, I don't know. It's like that story about when you go on a car trip and you put the kids in the car and they all act up and then you say, we're going to pull over and we're going to get everyone straightened back up and then everyone's fine for the rest of the trip, right? That's exactly what starts out the day. And
I have used that technique.
and Dr. Halverson helped us out last Saturday. So
And
thank
it
Good.
went well. A glitch or two, but overall, very well.
and see, it was bumpy at the start, wasn't it?
Yes, a little bumpy at the end also. But
They didn't tell me about the end. They only tell me about the start.
then I retract my statement. It was very smooth sailing.
I gave you a kudos today because someone asked if I had any concerns about Dennis vaccinating. And I said, I'm very proud of our Board of Health dentist. He participated in our clinic. I said, Dennis, give nerve blocks into my mouth. I certainly have no concerns that they would be able to vaccinate.
Yes, I'm actually looking into the requirements and when the classes start so I can do that.
Oh, it's online. It's easy. You can come with it.
Okay.
But I said, no, I have no concern. It's funny, the questions you get asked in some of the media. It did remind him today, and you'll all get a chuckle at the end about Valentine's Day. They're all worried about it. I said, well, I would be remiss if I didn't talk about STIs over Valentine's Day weekend. So practice safer sex and wear your face coverings when outside of your household.
There you go.
I didn't use off-color language. I just was being, these people are all worried about Valentine's Day. I'm like, well, we got to watch this because we still have STDs running rampant in the place.
I thought all diseases were cured now. It's just the virus.
That's what I know of.
Goes,
The only thing I can think of is chicken pox, measles, and mumps have gone down because nobody's going to school.
Well, I think that, what's really gone down is our influenza. If you look at our weekly influenza report on the site.
Yes.
And again, it's the same, not only vaccination being an important strategy, but think about, the face coverings, washing your hands, social distancing, not coming to work or school when you're sick. Those are all the same prevention messages. I think.
Yes, I agree. We have a quorum. If we would like to start, we can.
sounds good.
So I will call the meeting to order. I need a motion to approve the agenda.
I
So
do.
moved.
Second.
Thank you. All in favor?
Aye.
Aye.
Agenda is approved. Meeting is started. Uh, We will go into financial statements. The first four are deferred: the resolution of expenditures, statement of fund balance, the financial review, and the balance sheet. Be deferred, though we will see them on Tuesday. We go into the bank reconciliations. That starts on page 2, the general account, the lead account, the abandoned properties account, and our state of Illinois e-pay account. Does anyone have any questions concerning those? And Jim, it doesn't look like there's been any changes or any significant bump
No,
up.
we have activity in our general account and
Right.
we need to move some monies back to the general fund. So we have that on our list to do.
Yeah, yeah.
Yep.
If no questions, we can move on. Thank you, Jim. We have the revenue and expenditure report that is also deferred. Our public health emergency reserve minimum graph, which is deferred, though I'm pretty sure we're staying about where we're at. I haven't heard of anything change that. And our accounts receivable, that is deferred. We will move into page 15 for the major expenditure requests, of which we have 2. Give me just a moment. And the first is for the January, let's see. Yes, first is for the January electronic filing fees for death certificates in the amount of $9,876. This is a budgeted item. Do I have a motion to approve?
So move.
A second?
Second.
Thank you. Do we have any questions or discussion concerning this? If none, all in favor of approving said expense, signify by saying aye.
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 Opposed? So passed. We'll move to our second, which is a maintenance for our IT servers that can be found on page 20. And that is an annual billing service contract. It is in the amount of $4,464. And that is a budgeted item. It's a yearly item. Do I have a motion to approve?
I will move that.
Thank you.
Second.
Thank you. Do we have any questions or discussion? If none, we have a motion and a second. All in favor, signify by saying aye.
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 Aye. Opposed? So passed. We have no proposed contracts and agreements. Do we have any additional information or need for an executive session?
No, we do not. We will be having a couple of agenda items. Is one, I got the invoice for our Rockford Regional Health Council dues. And so we can have, we did not put it on just for approval because I think last year we had some discussion about the value proposition on it. So, we'll have it as a discussion item for the board, and then we can put it on to the February. Oh, yeah.
March.
March. Oh my gosh, I'm in a time warp. March.
It's moving fast.
And
Are they requesting a increase?
I have not done an analysis on it yet.
Okay.
I suspect they are, Jim.
Okay, I would suspect so too.
We don't.
Well, it's kind of a public relations thing, but we can discuss that definitely.
Yeah, no, I know we had some discussion last time rather than just, and so I thought I better put it as an agenda item for discussion and then we can put it back onto the finance committee for approval of the expense or
Thank
in the
you. Thank
direction,
you.
but what the board moves on at that point.
Sounds good.
Any further additions?
We may have our grant in, Jim, on the vaccine administration grant. It's not huge, but that would be one that we would accept coming. We're most likely going to have, I don't know when they're going to have it done, but it may come before this board by the February.
I had a question. They had a question on it today about the Qualtrics system. So
I just saw that, so I'm going to prepare a written response.
I kind of responded like I was a novice, so that they could, if they want something, more technical or more detailed, that we'd have a second chance at it, so. And if they say, okay, then we're done, so.
But it's worth a try, and we have other mechanisms to get that. And, they just want them.
Mhm.
Then they were supplying them like, well, because your system didn't come till after ours, so therefore conclusion. But Jim, I think you probably put it more succinctly and more eloquently than I would have.
Which is a better system?
Oh, I don't know if we can go with better or worse, Angie. I mean, this is the challenge. I'm sure that any system that you use effectively will work for you. The challenge is it's when it stood up, right? So for us, we think about this. We've been, you were on the last call, so maybe I'll share. Jim's going to be at board, but I'll show this group because I know we showed it at the last one. Let me show you a little bit of our information. And Angie, can you see screens? Yeah, you can see screens, right?
Yep, I see everything.
Okay. Oh boy, that's kind of scary.
Whoa. Did
Oh,
not
don't you-
know that.
Oh,
Yo.
don't you be doing things hand singles and all this, because I'll be able to see it.
All right. So you right now, you're just seeing me log into. So I want to say that probably when you say better, Angie, I think what this was able to let us get a heads up on registration. And so I showed the policy committee because we were looking at some things for a different reason. Can you see that?
Not yet.
No.
I may have got it. There we go.
Oh, yes.
There we go.
Okay.
So this is our registration dashboard. They know they've got something not working quite right in there, but at this point, we've got almost 66,000 people registered in our system right now that have self-registered, right? So that would have required us to manually enter 67,000 people, right? Think about that.
Yep.
We talked a little bit, you can see Saturday and Sundays registrations go down. Can't imagine why that is, right? And then they pop back up. Monday's a big day and we kind of cruise around. But we have, this is actually mislabeled. It should be racial breakdown. We're just kind of messing with the dashboards right now. And I don't know, Jim, if you had some work done when you were at the college using Qualtrics, but these are what they call widgets and you can.
Right.
But you can see the age breakdown, and we kind of laughingly said, look at the good news. Our seniors are not technology challenged. There are some that need assistance, but look at this group, 65 and 75, they're on the electronic system. They're getting registered on. And obviously, I said, you're beating out the 16 to 35-year-olds, just so you know. So that's all good. So, I mean, it's interesting. And again, this is probably where we're learning a little bit more that, again, females are more likely to register than male. And then reported health conditions, this is generated off those questions. So in this case scenario, you see obesity is one of the biggest comorbidities people are reporting, followed by diabetes, heart disease, and the lung disease, can kind of trickling down from that point. Here's another interesting part just for all of us to understand is how are people accessing the system? Predominantly a Windows-based platform followed by iPhones and iPads. So people are using their technology in different ways. This is the occupation questions. So you get a sense of, let me see if I can get it to, this is alpha. This is top down, but again, kind of take a look at, right now we're looking at this healthcare worker group, this 2,000 plus here, and there's another one, healthcare 2158. So we know we've got about 4,000 healthcare workers still out there that have not yet received vaccination that we have to move through. This is extremely challenging, and then you get to things like, I'm thinking, where's education? Our biggest group, almost 9,000 people, and by 10,000 people in education. So again, as we work through these systems, we bring them through the system and be able to register. And you can we can mess around a little bit with that. And I'm going to take you then to see. Okay, so tell me how we're vaccinating at this point. Sorry, Angie, I know this is a repeat. So.
Oh, that's fine.
But this is just documented through Qualtrics. This does not include all 3 health systems are documented through their system. But from yesterday, we did 372. It gives us an idea of where they're going. The vaccinations per week, first versus second dose. We're doing mostly first dose, which makes sense, right? We're just getting into the second dose realm. And then vaccinations by location. This is called the bragging rights screen, but we don't show it to too many. But the Hananiga Nation group just finished theirs and they did a big bunch. But the Auburn High School, they also brought in Winnebago High School, they brought in Duran, Peck, and Winnebago there. And UIC Health Science Campus just did a vaccination event. So
Yes.
they did their first, they survived, they did a good job. And then you see Constance Slade, and then today they did a small clinic at this week at Mosaic, right? So you can get an idea, but you can sort by different. If I wanted to know how many they just did, since we'll give it a little bit. This is just for UI Health Services. They did 298 today. And then again, they've only done 1 session, so vaccination by week doesn't make much sense. But I think what you start to get is look a little bit about where their zip codes are at. So they definitely pulled their patients from an area surrounding the college, not as much as you would have thought. But then here's where we're going again. This is not ethnicity. I come back to its racial ethnic breakdown. But this is where we're still struggling, and we're going to have to really start pulling through a little bit more to get more individuals registered to get them through. And I'm looking at one system, but overall our numbers. And then get an idea of age, again, breakdown. And probably the next biggest one that everyone likes to look at is the side effect. So 72 hours after you've been registered and you had your first dose, if you've been documented in the Qualtrics, and they're going to be pulling you all through the Qualtrics as well, for those of you who are coming Saturday, not to worry. These are the adverse reactions. So far, we've had about 1,636 have responded. The majority are complaining of soreness in their arm. So not much to be scared about. Tiredness or fatigue kind of rolls out at 31%. Then you've got muscle or joint pain, stiffness, headaches. And then you kind of get out to the end. 1% identify shortness of breath. 16% had no symptoms. So nothing happened. They weren't worried. Nothing went on. And most felt better. You see most occurred within 1 to 4 hours after receiving the vaccination, which I think is important information for education. Yes, Dr.
Are we breaking this down between the Pfizer and the Moderna also, or no?
Not at this point. We have not. Right now, because I'll show you where we're at. Most of our clinics have been Moderna, but we'll be able to do that.
The only reaction I had to it was like 24 hours later during the night. I had horrible chills. Like, my God, my teeth were even chattering and my body hurt all over. But by the time I got up in the morning, it was gone. And I know of someone else who had that same reaction too.
Yeah, it's not uncommon. And if you have it within the first 72, they say if you have it within the first, 24 to 48 hours and it resolves within 72, we're not worried that you have an infection of some sort.
Mine was like 24 hours later.
Yeah.
And no problems after that.
And there's a lot of detail. And again, the majority of people said their experience was, either extremely good, somewhat good, right? 2% said it was bad. So, we'll have to find out if there were lots more in that. But I think the other part was 99% said they're returning for their second dose. So whatever the side effects that they're experiencing, it's not sufficient to have them not return. And this one talks a little bit about your symptoms, ability to return to work, because a lot of places were like, do we have to schedule people off the next day? Or, should I be worried about that? The majority, when you think about 23.5% and 58 so close to 80% at this point, we're not impacted enough to not be able to return to work, right? And then you get some gradations and, moderately, and the severity of the side effects, again, slightly bothersome to, not bothersome at all. So I think these are all interesting things that we're learning about that, as we do more and we're documenting more through the system, we'll be able to kind of have a better sense and feel what our patient population is experiencing.
Now, we've seen the response and how many people have signed up. How many vaccinations has the health department actually distributed out to be given? How many have been given in Winnebago, approximately?
All right, so let me take it, that I can't do from here because I don't document all of them. So I'm gonna, all right. And I apologize, I have to always go. They have multiple places. So this is where we go. This is where we go because it's all of Winnebago County. So it includes everybody who's documenting in every system for a person who has a Winnebago County address. Click here for vaccination details. And then you hover over your So we have administered over 28,000 doses throughout all our systems, and 7,000, about 7,800 have been fully vaccinated, meaning they've received their 2 doses, which represents 2.73 of the population that they give us the estimated on. And this is not accurate, we know. Last reported no, this is not, can't even be correct. But again, so, I mean, there's a lot of data points, right? Because this is pulling through the eye care system. So it includes our Qualtrics, the Epics, some of our, like Crusader uses a different medical EHR for documenting. And when we first started, we documented through our Patagonia because we did not have Qualtrics. We got those first doses in December, right? Before we could really even stand up. We were building and flying these ships at the same time, but they eventually all roll into here. So you can cruise through this site anytime you like.
Okay. Have we started to run into shortages from the government?
Yes, we did not receive vaccine this week.
Wow.
We had allocated everything out.
Mm-hmm.
And so we have watched every day. We had to cancel or postpone is the correct term. We've had to postpone some of our what we call closed pods. We had some sessions scheduled with the public schools, with Rockford Public. We postponed them to the next week because we did not get a shipment of Moderna. And actually, we managed around a couple of things to be able to do some second. We had to make sure we reserved enough for second dose. We were doing second dose at milestones and stepping stones this week. So it's, the supply chain has not completely, I want to be honest with everybody. I say it in the press briefing all the time that the demand outweighs the supply at this point, and it's significant. And so people are extremely frustrated about how to get a vaccine. It seems like there's so many challenges to it, but that's the reality we're living in. We request, we allocate, we advocate, and then we, judiciously use the vaccine that we have to make sure that we're able to accommodate certainly second doses and then move forward where we can on first dose.
I have a naive question, and that is, how do those figures you were talking about with the Winnebago County Health Department interface with, Walgreens and, other sites that are actually also administering the vaccine?
Everybody rolls up into here because this is coming off the Illinois State Registry.
Okay.
But what it doesn't help me is there's no one registration system. So if when seniors ask me, and I'm going to say you're over 65 and you want to know where should I go? I say register on every system you can. So you're going to register on ours. If you can get on the Walgreens or whenever the next one, CVS, Hy-Vee, whoever, opens up, register on theirs. And if your health system calls you, take the first available appointment. Because the health systems are not using any particular registration system. They're going through their electronic health records, which mostly they use Epic, and they're either reaching out through the MyChart, they're calling, or they're doing outreach. So like, for instance, Oak Street Health, they are just calling people from there. And of course, everyone on their team is over 60, their client niche is over 65. But our FQHCs are using theirs as well. So both Crusader and UI Health, we allocated vaccine to them to vaccinate their over 65 and over population. So there's a lot, we're doing a lot with vaccine allocation. There's a lot in the vaccine management part that outside of just administering the vaccine is quite challenging.
So the vaccines come into us initially, except for those that are Walgreens or other, they have their own source of vaccine.
Yep. And the hospitals have not yet gotten their own supplies, nor have the FQHC. So we allocate from our allotment, which it's as a health department, I allocate to my group to make sure. So health department's focused on what we call 1A, 1B frontline workers, right? And the health systems are focused on their 1B 65 and over. We're attacking from many strategies, as they say, from all fronts.
Wow. Complicated chessboard.
I know. And it's so, you can imagine so many people are frustrated, but then we were just on the call policy and one of the person said their health system had already called, but it's.
Speaking of the frustration, I received a call from a previous board member.
Oh, yes.
Who raised, she had some concerns concerning the underserved in the area on the zip codes of 04, 02, and possibly 08 due to locations of where they're being given and not being on bus routes. I can give you the information she gave me. I told her we're dealing with it as best we can. And she had mentioned, I think one of Swedish Americans branches, I said, that's really up to them to decide. We're not allocating the places.
Yeah, most of them are doing it at what I call their ambulatory centers, which were mostly outside of the city of Rockford. So that's all and I know I don't dictate, but obviously as we, and again, are we off recording at this point? We probably should do some. Well, we'll talk a little bit more. We've gotten some resource allocation from the Illinois National Guard, and I'll share. There's not a decision making, but we are going to be standing up more on the west side off of to get a little more. But we also, with focusing on, I'm going to say the phase 1B. Let me see if I can. Let's see if I can.
You need me to call for an adjournment first, Sandra?
Yeah, we can do that, but it's nothing that the public shouldn't see. I mean,
okay.
It really is that phase.
The public needs to understand too that this isn't. It's going to take time. It isn't going to all happen in one day. There's no way it can, and it will get done. We will all get done if we don't panic, and that's where part of it's coming from. We're panicking. Machines can only put out so much a day, and if they break down, then they're holding us up a couple of weeks too. So you have to take in consideration of everything, how many people we're working with, how many places we have to be, and how many, it would be wonderful if we could just wave a magic wand and everyone gets done in one day.
Well, and I don't think, and I think people have a hard time understanding. Look, okay, so this is phase 1B, and we just heard they haven't updated yet with their new phase 1B plus, right? So for instance, like the hospitals and their healthcare partners are all focusing on that age 65 plus, right? So here's where the health department's all focused, down in here. So first responders, so just so you know, when we vaccinated in the schools, like for instance, Peck, Winnebago, Durand, we pulled in those respective fire protection districts as well as the law enforcement from those areas. So they operated, we put them through that. Then we had this education. So, I told you about the teachers, but also look at this. We've got congregate, pre-K through 12. So we've got daycares and childcare that we're responsible for. So we've got to, and typically we're doing those in the workplace. So that helps us get some of our minority populations that are working that can't get out of their workplace, to go into a vaccination site or clinic appointment, right? We are trying to vaccinate in their workplace to make it, as we say, as Mike Bacon would tell me, the easy choice. It's the easy choice to vaccinate. I don't have to leave work to get vaccinated. Then we are also right now outreaching to all of our food processing plants, of which we have about a dozen in Winnebago County. Now here we go, processing plants, veterinary health. So there is no one big group, but we are going to then put the call out, livestock services and animal care. I mean, we've got, so like Winnebago County Animal Services is in this group, in addition to, I'm going to say all our veterinary medicine partners. Then manufacturing, distribution of good for retail, wholesale, or other manufacturers. Do you know how big that group is? It's just, it's, so we are down in this grouping here, trying to vaccinate in their workplaces as much as possible. So that, to that board member's question about there are no clinics, well, it's because those clinics are coming to them. Now,
Sandra, can you send this out to us so we have it?
well, this
I,
is,
I know who John's talking about because she called me first and was running me up and down with all this stuff. And they have to, people don't understand how many places we're split up and doing. This would really be helpful for us to refer to also.
sure,
That we're trying to do individual plus all this.
Yeah, I can send out those links. I'd like to see it a nice succinct little statement, and maybe I'll work on that for that. But I think that there's that misnomer that somehow you have to go someplace. So in these workplaces, we are trying to go to them. So like we are reaching out to the Myers, the Woodmans, the Schnooks, you name them, the Aldis and everybody, because again, they're not letting, workers typically work very interesting shifts. They have to do stocking. They have all that kind of stuff. So if we can go in and blitz them with 150 vaccines right then and there for their workforce on some of the smaller ones, and think about how big like Woodman's is and how much staff they have there. We get that accomplished very quickly in that way. And then again, for these kinds of places, you're not taking people out of those locations to get them vaccinated. We are going to be going into the homeless shelters and all of those adult daycare centers, because it does not make sense to have them travel outside of those settings to be vaccinated. So we're trying to we're doing a two-prong approach. The health systems are bringing their patients in, and we are going out to the workplaces to get with our teams to vaccinate. And when we have the Guard come in, we will be doing a combination of both what they call mobile site with us, as well as standing up a location, but it will be by appointment, because you don't want people to come when there's no vaccine available, right?
Right.
If I understood the former board member's concern, it was for not so much the workers, but more of the over age 65. So being able to explain to her that that is the healthcare centers reaching out, including Crusader and such,
Right.
that may help. But again, it also breaks down to why we may be right now the initial point of all the vaccine distribution. We're not in charge of where it goes once it's out of our hands. So, we can't dictate where Swedes or St. Anthony vaccinates.
Clinics, right. And again, though, I know that they're trying to pull through. I know very much so that they all have some kind of a procedure for prioritizing how they get contacted. And many of them were concerned, I think, and you may have to explain this to the board member as well, is that this is in addition to our day jobs. I call it that. I try and put that to the media, like this is over and above what they normally do. So they try and find a location. So not only do you have to vaccinate, you have to monitor someone for 15 to 30 minutes, right? So it's socially distant. So it's not like I can just do a lineup and then you go home, right? So I vaccinate you. I have to put you someplace for 15 to 30 minutes to monitor you for side effect. So oftentimes their footprints of their clinical areas that they normally would do it in is a little more challenged. So they've got to take that into consideration. I'm not, some of them will integrate it. I know UI Health tried today at the College of Medicine. I think they decided they may go back to their home because I think you learn things. You're like, yeah, I think I'll try it this way, and maybe that doesn't work as well. But I know like Rock Cut is OSF's major outpatient center, right? So that's where they see their patients. So they're there. And Mercy is doing it on Rockton Avenue. So I think that that's definitely their patient population of area and concern and need. So
That's your top zip code areas too. That's 61101.
So that they're doing Rockton Avenue. The only one that's kind of out of their turf, I'm going to say, from territory is Swedes took it out to, I think they're at Loves Park City Hall or something like their municipal building. And again, I think everyone's trying to figure out the most effective strategy to get this done as quickly, expeditiously, and really with the understanding of with that equity lens applied to it. But, right now with so many people eligible in phase 1B, it's really, really challenging. I think we thought it would roll out a little bit slower in terms of eligibility, not necessarily vaccine quantity. I think we all knew that was going to be a little slower, but when you start opening up everyone, I've already gotten multiple calls just sitting here about disability guidelines now. And I'm, how do you say, I'm still got phase 1A, I'm moving a little forward, but then I got to sweep back and get those phase 1As and then move forward and sweep back. And, I think there's concerns among those who are 65 and older. Why are the younger people in the schools and workplaces getting it? And the schools and workplaces are going, well, that group should be staying home and staying safe. We have to go out in the workforce, so no one's happy. No one's basically, and our former board member, I say one of the side effects, it's his irritability. We call it COVID crankiness. So that should be the number one symptom. I think people are tired of the pandemic. They want it to be over with. They're optimistic about the vaccine. They're accepting the vaccine at high rates. And we're just that's the positive side. The negative side of we can't get it out fast enough to people that need it and want it.
Sandra, you might want to also present this particular page here to our board members on Thursday night, so they know that we're all over the place. And I think it's important for you to also tell them that that you're doing the injections. You do your daytime work first, and then you're having to do this too. They don't understand that. They think all this goes on in 8 hours a day. And sometimes you have to paint them a picture and let them know there is no 8 hours a day in your business.
No, and again, I think that people think there's no magic resources. We can't manufacture vaccine. It's being manufactured very quickly. I mean, but again, there's such a high demand nationwide. So it's the state, it's the nation, it's counties. And
it's Rockford, Illinois.
But
if people don't see beyond their nose, they don't realize it's a whole nationwide situation. They just don't get it. It's all about. Oh, you might want to consider that if you can get on the agenda Thursday night. Oh, and you always ask you.
Yeah, I know yeah. I don't have enough hours in the day, as you would guess.
I know you don't. I don't know how you do it. I really don't know how you do it.
We're trying to, as I said, I will be county board because they'll be looking at some of the, we're working with them on, I think, Angie, they wanted to put forward the discussion on the permits. So we'll talk about that a little, that's not something we can make a decision on. It has come back through our board. We may have that for Tuesday night. So we'll see, but it is, I think that people don't understand how many moving parts it is and that it's not as straightforward. And, I think they think we have 100 vaccinators available whenever and that's not the case. None of the systems do. Not one healthcare system has enough to staff it up. And there's the supply chain, there's the personnel, you may have enough supply, but not enough staff. Then you get too much staff, not enough supply.
I'm not sure, but the 2 weekends I've volunteered, I think at least 90% of the people there were volunteers, with people giving up
Absolutely.
in their evenings to do this. And that's,
And I remind people that this is your community working for you.
yeah.
Like, this is not, so when you get angry at people and you want to throw, oh, this or that, I said, these are your neighbors, your friends, your colleagues, who have stepped up to help out in some way, shape, or form. And, we've called it the all hands on deck, and there are many hands that are lifting those boats. So it's going to take a while. And I'm sure there'll be more resources coming, but it will not, until we have a 1-to-1 match for every person that wants it, they can get a vaccine today. I don't think anyone's going to be completely happy. So we call it COVID crankiness.
I think you guys are doing a great job. I will slip this in and do I have a motion to adjourn? We can discuss other things after, but we have a motion to adjourn the finance meeting for tonight.
So moved.
Second.
All in favor, signify by saying
Aye.
aye. Opposed?